problem with sodium is that by eating more sodium than we need, it puts us at high risk for heart disease and strokes. So blood pressure and sodium are related. So by having more sodium in your diet, it can raise your blood pressure. By increasing your blood pressure, you then are at higher risk for heart disease and stroke.
Processed foods are huge with sources of sodium, and I think a lot of people don't realize that when they're at the grocery store, like bread, that we don't realize that there's that are high sodium. And you know, you eat a sandwich, or you eat bread for breakfast and bread for lunch and then bread for dinner, and then it piles up. And when you're trying to keep your amount of sodium that you're eating during the day to about 2,300 milligrams of sodium per day, you don't realize how quickly that piles up.
This was a 3-year grant, and the focus was really to look at multiple strategies for reducing sodium for the largest number of people possible. We engaged 10 different work sites, 4 hospitals, 4 universities, 1 retirement community, 1 casino, and then we also targeted local pizzerias and got a local pizza chain to join this effort.
We worked with ZAG Dining. My specific role was to help with nutrition analysis of the recipes that they were using. Also to talk with the chef about different low sodium products that were available in the marketplace.
I would admit I guess I was pretty lucky. Obviously, Spokane Health District had a voice on the other side, meaning the vendors, so they were smart enough to be talking to our vendors, because the vendors were actually, when I called them, they already had the products in line.
That opened up the market for low sodium ketchup, and as a result of that, many other venues were able to take advantage of that.
With this type of targeted approach, we were able to reach over 18,000 employees and open up access to lower sodium foods to an additional 63,000 people. So that's what public health is all about. It's about helping as many people as possible improve their health and preventing disease.